When a urinary catheter causes discomfort or other difficulty for the patient, a suprapubic catheter, inserted through the abdominal wall, is used to drain the bladder. Before you provide care for a patient with a suprapubic catheter, verify the provider's orders. Perform hand hygiene and provide privacy by closing the door and drawing the bedside curtain. If the catheter is newly established, you will need to use sterile technique to cleanse the site and change the dressing. For a well-established suprapubic catheter, aseptic technique is sufficient. Introduce yourself to the patient and explain the procedure to her.
I'm Jennifer. I'm going to be your nurse today, and we're going to take care of cleaning your catheter site. First, I want to check your ID band. And if you could state your name for me.
If needed, raise the bed to a good working height and lower the rail on your side.
All right, very good.
If you're cleansing the site for an established catheter, you'll use aseptic technique. Begin by applying clean gloves and remove the existing dressing. Note the type of any drainage present. Now remove these gloves and perform hand hygiene. Hold up the catheter with your non-dominant hand as you work. Be careful not to place tension on the catheter. Cleanse the site with soap and water. Use a circular motion and begin near the catheter insertion site.
One more washcloth.
Continue outward in progressively widening circles for about a 2-inch margin. With a fresh washcloth or gauze, gently cleanse the base of the catheter in a proximal to distal direction, moving up and away from the insertion site. You may want to apply a drain dressing around the catheter, using split gauze taped in place. Secure the catheter to the lateral portion of the patient's abdomen with tape or a multi-purpose Velcro tube holder. Mark the new dressing with the time, date, and your initials. Make sure the patient's drainage bag stays below the level of her bladder at all times. Coil any excess tubing on the bed and fasten it to the bottom sheet with a clip or other securement device. Dispose of all contaminated supplies. Remove your gloves and perform hand hygiene. As part of your follow-up care, plan to inspect the dressing at least once every shift. Monitor the patient for discomfort and signs of infection, such as fever or an elevated white blood cell count. Document the character of the patient's urine, the type of dressing change, your assessment of the insertion site, and her level of comfort with the catheter and the dressing change.